You're listening to Bullpen Science with Dr. Richard Aplin, the podcast that gives you real health solutions to your real health problems. And now, your visionary host, Dr. Richard Aplin.
Hello everyone, it's Dr. Aplin with Bullpen Science. I'm here with Teresa and Glenda, and this edition of Bullpen Science, we're going to be talking about solutions. As you heard in the intro, it talks about real health solutions to real health problems. When I was traveling to work this morning, I heard something on the radio that made me start to think, and it has to do with this epidemic that we have in this country about opioid addiction. Opioid addiction is a horrible, horrible problem in this country, and it doesn't seem like there's any way out of the situation. And so the thing that caught me in the conversation was the fact that the government agencies are looking at the doctors that are prescribing the medication as the problem. And I thought, I'm sure these doctors are doing exactly what they feel needs to be done within the science that they operate. And if you think about it, finding a solution to this problem within the science that you operate really doesn't offer an appropriate solution. You're going to have to step outside and look at the processes that are occurring for you to make a decision on what to do about it. All right, so this is a topic I wanted all three of us to talk about because I think it's pertinent to what's going on today.
Yeah, it kind of hurt my heart when I heard you say it because a couple days before you mentioned infancy addiction. And so this thing is becoming generational. It really is worth looking at a solution here so that we can stop some of the generational things that are going into place. But what you said just a minute ago kind of piqued my interest. You said pretty much within the parameters of what they know to do. So, I don't think anybody here thinks doctors are evil and they just want, whatever, or they just are scared of being sued. They really do want to help you find a solution. So with medical doctors being taught for, I don't know how many years you have to go through this process, how can we turn this around? How can we turn this around? It's us.
It's huge, isn't it?
It is big. So.
Yes, it is quite huge. And honestly, you have to use a different science. See, the science of the human body in our culture is really just a cause and effect type science. Uh-huh. And that's really not the way the body works. The body is a system of systems. And so when you express a condition, it is the result of a process. And seeing that's where the fault lies in the science that we're currently using. We do not take into consideration the process that causes the condition. And so, just like this doctor was being interviewed on the radio this morning, he said, when you have a patient sitting in front of you crying in obvious distress, it's hard not to prescribe a medication that will stop that pain. Now, the fact that the process that created the pain is not being addressed, how are you ever going to have a solution? You're not. You're just perpetuating a bigger problem.
That's just it. I think society, we're relying too much on the easy fix.
Yeah.
Prescribing medicines, and, we see that a lot, hear that a lot in here. Patients will say, well, I feel better, but nothing has been addressed, changed, or fixed. They just feel better. The process hasn't been fixed. I think doctors are somewhat responsible for that. It's just relying on that easy fix and not getting past that point.
Right. And it's the process issue has to do with the science that you're using. If your science does not afford you an understanding of the process, then you really don't have a solution. And that's really what I see day in and day out. We constantly educate in this practice. We're teaching people to think past their current situation to the process that led them to that condition. And by doing that and teaching people strategies that they can use day in and day out to change that process, that's the reason why we have patients in here that say, well, I've tried everything and nothing works. And then all of a sudden this starts to work. Well, the reason why is because our application is different. Our science, even though I have a degree and I have a number of degrees, and these degrees were based on this straight line science, which is cause and effect, we have spent the last 15 to 20 years exploring systems. And so understanding the system and the expression of a condition is that product of this system, then changing the way the system operates will change the product. And that's the reason why, you see it. Well, the patients that are in here, we have patients with a number of different conditions that honestly would have never considered going to a chiropractor.
Right.
But what we're missing out there is that chiropractic is the tool. Doctoring is the understanding of the system.
Correct.
All right? And so, it really tugged at my heart when I was listening to the discussion this morning about opioid addiction, because I see it firsthand. And you have got to change the way you look at this. You cannot continue to look and try to develop some whiz-bang drug, all right, to substitute the addiction process. It just will not work.
So explain why chiropractic is the tool. What does chiropractic do?
Well, the nice thing about chiropractic, it has the ability to disrupt the way the nervous system is operating. When you apply an adjustment neurologically, you literally can change the way the brain processes information. And that's the key to it. Change the way the brain processes. Now, with a medication, you could sedate it,
Right.
but you didn't change the process.
Right.
You can excite it, but you didn't change the process. But the adjustment offers a moment of peace so that you then can give them a strategy to reprogram the process.
And that ultimately that's what it's all about. Because anything from that point, if you can change the process, anything from that point is up for grabs. You can start from the ground up and change the way the process forms. Is
Absolutely.
that correct? Okay. And so even really it all starts with your way of thinking. Because if I have seen patients that don't believe in using traditional medicine,
Right.
in using pharmaceuticals, but they will use an adjustment the same way. So it really is your way of thinking that needs to change, because you still want to attack the symptoms, but from a natural standpoint, that still is
Right.
not the answer.
That is working. It's a substitution method within the same science. And that's really not what chiropractic was designed to do. It works incredibly well in that science. A person comes in and they're in pain, you can adjust them and stop that. I talk about people getting in the ditch. When you're in the ditch, you need to get out.
Yeah.
All right, but if you don't look at the process that keeps putting you in that ditch,
You'll live in the ditch.
absolutely. And so, it doesn't matter if you're using synthetic medication or if you're using something completely natural, whether it's homeopathy, acupuncture, chiropractic, naturopathy, reflexology, it doesn't matter. You're still using it the same way.
So we've got to change things up.
We have to change the process, and that goes to what you said about the way we think. And that's the reason why the declaration of intent on this practice is to change the generational cycle of sickness. That's the way we think.
Yeah.
And as a result, we can change the expression of the human spirit.
That's good stuff.
That is good stuff. Well, I hope you guys have enjoyed this edition of Bullpen Science, where you get real solutions to real health problems. This is Dr. Aplin.
Glenda?
Teresa?
You guys have a great day.
You've been listening to Bullpen Science with Dr. Richard Aplin. To learn more about real health solutions to your real health problems, call us at 256-203-9433 or visit us online at envisionchiropractic.com today.